Hello everyone, so this week's topic is the global burden of pediatric disease. We had a really interesting lecture by Dr. Andrea Hunter, a pediatrician here at McMaster, with a focus on pediatric refugee and immigrant health, as well as global child health. So first we talked about some mortality data and how to communicate these huge numbers to the public. For me, once the number reaches in the millions, it becomes difficult for me to even fathom what the difference between 3 million versus 6 million people would look like. One way that we talked about bridging this gap is to relate it to a familiar population. For example, in 2013, there were roughly 6.3 million deaths in children under 5 around the globe. In order to communicate this number to a Canadian audience, you could relate it to the population of Toronto, which incorporating the Greater Toronto Area or their surrounding areas is approximately 6 million. So researchers also often break mortality rates into the number of deaths per day. For example, under 5 mortality in the same year in 2013 was roughly 17,000 deaths per day. All this to say, pediatric disease plays a huge role in the global burden of disease, and it can sometimes be hard to communicate those huge numbers to stakeholders. And the scope of the problem is much bigger than just mortality. Since we're dealing with children, morbidity can result in lost productivity for the remainder of that person's life. An economy simply can't thrive if it's losing a significant part of its workforce before they even enter the workforce. Like so many of the other topics that we've discussed so far, the problems associated with pediatric disease are complex and multifaceted. The burden of pediatric disease is not evenly spaced, with low-income countries having disproportionately high levels of child and infant mortality. Partway through the lecture, we split up into groups to discuss the major causes of child death, and our group had some interesting insights, and I'll just share those with you. So we talked not only about respiratory illness, malaria, diarrhea, and neonatal deaths, which are major causes of death in children around the world, but we also talked about some of the more upstream determinants that impact these diseases. For example, malnutrition can result in low birth weight and non-breastfed children, which can also lead to increased infection rates. Similarly, poor hygiene and lack of access to clean water can increase the risk for diarrheal disease, like we talked about a few weeks ago. And these more upstream determinants are also influenced by macro factors like low socioeconomic status, a lack of health infrastructure or public health initiatives, political conflict, or government corruption. So as you can see, these are issues that are much more complex, as a lot of issues in global health are. I think the example of mosquito nets really highlights this issue. So an article in the New York Times talks about the issue whereby mosquito nets meant to prevent malaria are being used for fishing. This is problematic not only because the nets are not fulfilling their purpose of preventing malaria, but the permethrin-soaked nets are toxic to fish and have resulted in a collapse in Uganda's fishing industry. This just goes to show how a seemingly simple solution for malaria, giving people mosquito nets, requires education as well as cultural considerations. So that's all for this week. Stay tuned next week when we'll talk about the global burden of maternal disease.